making me dizzy. Alright, hello. Can you do the top of my head off? Alright, so I have orders from the provider for an NG insertion. I have explained the procedure to my patient and placed her in high Fowler's position. I have gotten my equipment ready. And I'm going to place this on her, and alright, and then so before starting this process, I want to osculate her abdominal sounds, a full assessment, so that means distension, pain, discomfort, if she's having nausea, vomiting. Right, so there isn't much going on in there, so we're going to continue the orders, nothing to report to the provider. Alright. I have my tubing, and I want to start by measuring it. I would start from the nose. I would start from the nose to the earlobe and then to the xiphoid process. Once I hit that mark, I would get some tape and just make an indication of where I'm going to put that, or where I'm going to stop when inserting. And then I would coil it up, put it on some ice, let that harden a bit for the insertion. And I would provide my patient with an emesis basin, water to help with the process of it going down, and then a tissue if needed. Alright. And then once that has cooled and gotten to the point where we like it, I'm going to take this. And I lubricated it about 4 inches. And I have checked my patient's nares. I'm going to go with her right. It's the most clear. I'm going to have her lift her head up. And I'm going to insert past the nasopharynx. Once I get past there, I'm going to stop, give her a break, and then have her tilt her head forward. Once I do that, I'm going to direct her to take drinks of water as I'm inserting. So I'm going to tell her drink, 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 and then she can stop. I'm going to grab some tape, tape that down. I don't want to let go of that. And then as well as taping it to her gown. And then allowing enough leeway. You don't want it too taut so she can still move and go about her day. And then I would unclamp my tubing and just get a little bit of the gastric pH, the gastric secretions to measure her gastric pH. It's just a little, only need a little. Reclamp. I'm going to put it on a pH strip, and it should read about 1 to 4 for the gastric pH. If it's greater than 6, it is not in the place where it needs to be. So it says 6, it's good. I want to get an x-ray just to make sure it is where it's supposed to be. And then if I have any resistance, I want to, oh sorry, I lost my train of thought. And then once I start the suctioning, I want it on a low intermittent suction. And if I have any trouble with that, if it's not coming out, I would add 5 cc's of air. That would just get the tubing off the side of the stomach. Push that off. And then I would recheck, see if the volume is going up, if the nausea and vomiting is being relieved, which it is. If I had any troubles while inserting the tubing, if she would start gagging, I would check inside her mouth to see if it's coiling. If it was, and she was persistently gagging, I would stop and redo the insertion. Then once I start as well as when I start the suction, I want to note the color, the amount, consistency of it. I want to make sure I do that, and then noting when I did it, where it was inserted, the location, so be the right there. Make sure she's okay, if I can get her anything else, and then every about 4 hours I would do an additional abdominal assessment and vitals. So I would check that, see how things sound. Alright, sounds like it's working pretty effectively. That's good. Make note of that. So we've been checking every 4 hours. She seems to be residing or not having more nausea or vomiting. So the provider has ordered the discontinuing of her tubing, her NG tubing. So we're going to go along with that. I have identified my patient, explained to her the process that we will be doing. First, I want to get 20 of water and then additional 20 of air. Once I get that, I'm going to unclamp the tubing, insert that. This will help just with the patency, relieve any heartburn, if any, while we pull that tubing out. Alright, so wash my hands, apply another paper to catch any secretions, if any. I would turn off the suctioning. We don't want to pull the tubing out when it's suctioning. That would not be comfortable whatsoever. She has a tissue if needed. So I'm going to wash my hands. Apply gloves. Alright. And then I'm going to start by removing the tape. And then I'm going to give her an indicator when I'm about to pull. I'm going to count to 3. And once I count to 3, I want to take a deep breath and hold that breath. So 1, 2, 3. Alright. Then I'm going to coil that up, put that away. Coil that away for her. And then I want to reassess her abdomen and listen to those gastric sounds. It sounds good. Sounds like it's working effectively like we want it to. No distension. She subsided from vomiting. Nausea is gone. I would come back in another 10 minutes to reassess her abdomen as well. Make sure it's still all good. Document all that information, how she was feeling, any discomfort, the time I took it out, and yeah.